reverse. So you will talk to verb bankers, this is forward, this is reverse. So why you need to do a forward plus a reverse?
To confirm that the blood grouping was correct.
Yes, so it's basically is to tally each other to confirm. And as well, if you have discrepancy, which means like if the patient is having previous history of transfusion, you will find that the forward and the reverse will have some difference. So it also actually tells you. So in blood bank practice nowadays, in Malaysia at least, the National Blood Bank guideline is for patient it must do forward and reverse. It is not acceptable anymore to do only forward. Okay? So to do this method, remember, is not recognized anymore, but it's just to show you what is the method about. So basically nowadays you have these are called monoclonals. If you want to know more about this, you can go internet. Now all is monoclonal. That means all these reagents are all actually like use the biotechnology to actually make this. It's no more like the olden days you see polyclonal, some of them is still by a donor. So this is basically they inject the antigens to the rat and the rat produce the antibody, then they extract the antibody out to reproduce this. Okay, so to do the test, normally for normal cases you will put the blood first. Okay, so you can just pick one. Which one you want to do first? Patient 1.
Yeah, patient 1. Goes to 1, 2, 3, 4.
This is skin split.
That's
The number 1, 2, 3, 4.
No.
There's cell 1, 2, 3, 4.
Yeah, there's one. Okay, so basically, if you look at this, I mean, for information, this is not the real sample tube lah. So it's basically just packed cells from a blood bag. So it's just for you to perform the test. So when you do later, please be careful about the blood. Okay, blood is always hazardous to you, regardless it's already screened or not. But for this case, you can be assured it's already screened with HIV and hepatitis. So basically, just forward. Okay, just put like this. Okay. So I'll leave this here later for you to use. Okay. Okay, and then you just use. Okay. This one is the reverse. Okay. For reverse, actually, we do the forward first. So when you do this, please don't touch the blood. If not, you'll contaminate the. Normally, one drop will do. If it's this case, it's too big, you put 2 drops. Okay. So this is the B. Can anyone tell me why this anti-serous got color? Yes, it's to differentiate very good, and the color is universal. So you go to any blood bank also is the same. Oh yeah, the D. Sorry, I missed out the D. Okay, can anyone tell me about D? Is research, and is it the same blood group?
It's basically the research antigen.
Yes, but if you really study, it's actually different from the ABO group. Okay, so basically it's a different classification and antibody. Okay, so for this, you can do this. Okay, why you have to spray it? Not really.
Easy to see.
Yes, exactly. Very practical answer. Very good. So what you want to see?
Agglutination.
Agglutination. So how does the agglutination looks like? Anyone see? It's very clear, this one. Okay. So what did you just see? Actually, okay, if you can see, this is actually negative. Okay, you want to be controlled. Actually, for this method, you have to. It's a tau method. Tau method is supposed to bring to your hand and this move like this, so that you can visually see this anti-series move. Then you can see, you have to see at the sides. So this is actually negative. You see, there's nothing, no agglutination at all. Okay. Okay, so this is positive.
Yeah.
See?
Yeah.
You see?
Yes.
You can see visually the blood is come to. So basically, when you see, you have to see at the side. If this is the pool of thing, you see at the side, because the side is better for you to see. Maybe I should sit down because I'm a little bit tall, you cannot see. Sorry. Okay, can you see? Okay, so this is already positive. So this is positive or not? The NDD will take a little bit time. Yeah, it looks like.
Yeah, you can see that the phosphate crystals all come together.
Yeah, it's like a crystallized, right? What this?
No, it's positive for
Okay.
because it was antigen for A and antigen. Antigen was A and because it's A and B antibodies. Yeah, that means that means it's probably.
I don't really see. This one is probably. I think I know the story. Okay, never mind. So anyone can tell me why ABO is faster than NDD?
This is carbohydrate antigen on the surface. This one is for protein antigen on the membrane.
No, the other explanation is the NDD is actually is a IgG. So if you talk about the molecule is much more smaller, so the reaction will actually be much more. Yeah, it's positive lah. See, you can see very small one. Okay, so who want to do patient number 2? Oh yeah, the reverse. Sorry, we do the reverse first. So anyone can tell me what about the reverse?
This basically testing the patient serum against known cells.
Yeah. So what are you?
Antibodies against.
Yes.
Isn't that whole cell?
Oh, sorry. So
Oh, never mind. No,
we just remember. Wow, this one so dilute lah. Can see This is so it's actually a little bit too dilute. It's a little bit too dilute, isn't it? So serum. So the reverse will actually take time, and the standard laboratory for this reverse incubation is actually room temperature at 10 minutes at least. But it depends if your antibody. This one is they take this sample is a little bit slow. The cells is too dilute already. Okay, for laboratory actually for tongue metal, the concentration of the cells need to be at least 30%. So I think this one is a little bit too dilute to see. So do you see the NDD side here is already positive? I think the NDD a little bit weak already. Who wants to try?
I'm just try.
You want to try?
Oh, which one? The next one?
Yeah, the next one. The patient number